And welcome to the competency video for a glucometer. Today we will review the glucometer testing procedure and the quality control procedures for the glucometer. First, we want to make sure that we've gathered all the appropriate supplies. We have our glucometer, we have our test strips, we have our high and low glucose control solution, we have a lancet, some alcohol wipes, and some 2x2s. First, we will start with the glucose quality controls. Quality controls must be completed once every 24 hours for high and low on every glucometer that's in the center. And when you first take the quality control solutions out, you need to check and verify the expiration dates. So on these particular bottles, the expiration dates are April 30th, 2018 and May 31st, 2018. And they have been dated from when they were opened, which is an appropriate practice to do when you open any bottle that's multi-dose. You would also take the glucose strips bottle and verify the expiration on that, which is 3/31/2018. So initially we will take the one strip out at a time. One fell out. And insert into the machine, and that will turn the unit on. And you will know it's ready to accept the specimen when there's a blinking glucose strip on the screen. I'm just going to insert this strip back in that fell out. And we will start with the low controls. And you want to rotate the bottle just to mix the solution. Take the cover off and then squeeze gently until you have a hanging bubble, which you will gently touch to the end of the strip, and it will take in what it needs to run the test. The machine will beep once it's taken all it needs in and it's running the test. The results, you can see the blinking blue light indicates the results have been completed, and it's 47 for the low, and that's within normal limits for the low glucose control. You remove the strip and discard, and then we'll now do the high testing for quality control. And I didn't mention that there are two sides to the glucose strip. One is the black side, and that's the side that gets inserted into the machine to power it on. The other side is the area that it will accept the specimen for testing. If you put it in the wrong way, you'll get an error message and it will tell you that that's not correct. You take it out and reinsert it. I'm just going to wipe this down because there's an excessive amount. So I will gently squeeze, and then it accepts the specimen. Test is running. And that sample is 380, which is normal high for the high level quality control. Both of these results will be recorded in the quality control log and the CLIA logbook, and again it is performed every 24 hours. Once you've completed using the machine, you'll wipe it down in between every use, and it will be ready for the next person to do the patient testing, which we will now perform. When you're doing patient testing, it's important that the machine is clean and you've gathered your supplies, as well as communicated to the patient what test you will be performing. It's important that you solicit information from the patient and ask them where is the best location to obtain a finger stick from with an appropriate amount of blood. Patients who have been diabetics for quite a while may have calloused fingers, and that may be difficult for them. So they may be able to tell you a best site for that, and it's important for you to explain that to them and ask them questions and enlist their cooperation in this testing. If you come into a situation where you aren't able to get any blood from an individual's fingers, you can test the earlobe. It is a porous site and is relatively painless. So we will now proceed with patient testing. When you walk into the room, you will also verify two forms of patient identification, which could be your name and date of birth, not your name, but the patient's name and date of birth, as indicated in Wheeler Clinic policy. This is a national patient safety goal, and it's required for us to be sure that we verify patient's identification each time we do an invasive procedure or have first contact with the patient. And again, you will elicit some cooperation with the patient and gather some information from the patient. You will also perform hand hygiene and apply gloves. I will not be using gloves for this purpose test because I'm going to be using my own fingers. So I'm going to take a test strip out and insert it into the machine. And this is the lancet. With this particular lancet, we're just taking the cover off, and then I'm going to press it onto my finger and it will engage. Lancets come in many different shapes and sizes, and so become familiar with the lancet that is used in your location. They are single use, so they may not be used for a second patient, and they retract the sharp, so there's no risk of injury with them either once they've been engaged. So we're going to take an alcohol wipe and clean the side, or the side of the finger is the best location to test. And now it's ready once it's air dried for pressing the lancet to obtain the sample. Okay. Okay, it's engaged. You only need a very small amount of blood, and it's important just to touch the tip of the strip to the blood bubble, and it draws it up. Offer the patient a 2x2, and the result is 183. A little bit high. That result would be recorded in the patient's electronic health record and also in the logbook, in the CLIA logbook in the lab. The test strip can be discarded into the regular trash, and the lancet can be placed in the sharps box. The testing is complete, and so we will clean the glucometer now. And then you would remove your gloves to perform hand hygiene. And that concludes our glucose quality control and testing competency video.